Hello everyone. Welcome to Dr Samim Pedia YouTube channel.
Today I'll show you the step-by-step procedure of inline nebulization in neonates using the Dräger VN600 Neonatal Ventilator. This is a crucial NICU skill to deliver aerosolized medications without disconnecting the ventilator, ensuring safety and stability of the baby. This is the nebulizer unit or aerogen solo that aerosolizes the medication. This nebulization chamber is held by a specially designed T-piece connector. T-piece is generally attached to the inspiratory circuit of the ventilator proximal to the patient. A small tubing is attached to the side of the nebulizer unit, and other end of the tube is connected with a port in the ventilator, so that pressurized gas can come from the ventilator to this chamber and make aerosol. Now we are attaching the nebulizer to the inspiratory circuit with the help of inbuilt T-piece connector. Now load the medication, and for this, dilute the drug to 2 to 3 milliliters for effective nebulization. Then attach the nebulizer chamber securely into the circuit. Now go the ventilator monitor and select procedure, then go to nebulization option. There are different timing options like 5 minutes, 10 minutes, 15 minutes. But before starting the nebulization, stop the VG or volume guarantee mode. After nebulization, remove nebulizer chamber, ensure circuit is intact, reassess ventilator parameters, and again start the VG mode. During nebulization, watch for complications, like desaturation, tachycardia, increased airway resistance, and adjust FiO₂. If you found this helpful, like, share, and subscribe to Dr Samim Pedia for more NICU skills.